Stacey and Jay Spoo, KZN's #1 hit music station, East Coast Radio.
Today is World Cancer Day, a day to raise awareness, improve education, encourage early detection, and support people affected by cancer. And the theme this year, very powerful theme, United by Unique, reminds us that while every cancer journey is personal, prevention is a shared responsibility. We are all in it together. And in South Africa, cancer is a big problem, man, and it's urgent. The National Cancer Registry recorded 87,853 new cancer cases in 2023, with experts warning the true number may be even higher, with cancer cases projected to nearly double by 2030. Early detection and prevention are no longer an option, but very essential.
They are. And this is one of those conversations about accountability.
Yeah.
And regular doctor visits.
Yeah.
And scheduling things and sticking to those schedules, because forewarned is forearmed. So joining us today, we have Justine Lacy, clinical executive at Profmed, who believes that too many people are diagnosed late, not because they don't care, but because they lack access to the right information. And today's entire chat is going to ask one key question, which is, how do we move from awareness to action when it comes to cancer prevention? So, Justine Lacy, welcome to the show. How are you?
Welcome.
Good afternoon. I'm very well, thanks, and you?
Very, very well. Thank you so much for being here today, doing good work. And hopefully today, more than one person will be moved, right? So
absolutely. Thanks for having me.
We are thrilled that you're here, because this is a conversation that a lot of people hear the C word and then everybody kind of gets a little uncomfortable. One, I would imagine, because it touches so many of our lives. It's a difficult thing to talk about, but it's also, it's kind of like that thing we kind of want to put to the back of our minds. If we aren't aware of it, then we can be blissfully unaware. And in a bid to circumvent that, we will also hear from professionals such as yourselves and our doctors. The word prevention comes up a lot. What does that actually look like in everyday life beyond eating better, exercising? Like, when we say prevention matters, what does that mean in the context of cancer in particular?
So, Stacey, that's a great question, because it sounds like a slogan, unless you actually start unpacking it. So in cancer, if we're referring specifically to cancer, when we say prevention matters, it actually means that a large portion of cancers are either avoidable, detectable early, or less severe if we act before symptoms appear.
Yes.
So it's actually about shifting from reacting to cancer to reducing risk and catching it early.
That's very powerful. That shift will save many people's lives, and that's what this is all about.
Also,
that's it.
Something that you just said there, Justine, that's so important, is that we can control this. You know what I mean? If we are not reactive, instead if we are preventing, and that's positive. And that's a note that I'd like for everyone to kind of internalize. It's not all bad news all the time. This is for the betterment of yourself.
Yeah, and that's a big step in fighting cancer in South Africa and around the world. How can someone determine their personal risk and what they should do next when it comes to cancer?
So, Jay Spoo, this is a great follow-up question to the one I've just addressed, because this is where prevention matters actually becomes personal rather than abstract. So when you take it down a notch and you actually start personalizing it, it's about determining your personal cancer risk, which can be done in 3 steps. Firstly, understanding your baseline, and that is really looking at family history, personal medical history, maybe lifestyle and environmental factors that affect you personally, such as where you live, the air quality. Are you a smoker? Are you a drinker? What's your body weight like? And then actually identifying modifiable risks. That's the next step. And that really is reducing your alcohol intake, maybe stopping smoking or vaping, looking at your diet. And then thirdly, matching the right screening to the right person at the right time. So we can actually translate that into something quite easy, and that is really looking at your age and gender and how at risk you are as well, and then formulating evidence-based screening based on your risk level and where you're at in life.
Yeah.
So even though if you're listening to this and you're in the car, you're in, at the office, you are picking up your kids from school, it feels overwhelming, but that's why we have Justine here to explain it to us in layman's terms, because it actually isn't. It's something that we have to embrace. It's something that we can, to a certain extent, manage, and we do that by prevention. So who are you? Where are you at? Which doctor are you seeing? What are you seeing that doctor for? These are things that can be navigated, and just a little bit like we're just trying to help, we always good to know everything. And I understand I come from a long line of family members who love to ostrich about everything, especially when it comes to health. And so I try to do the opposite. I'm very much like, you don't feel like a doctor. So This is the same thing. If you feel like something is amiss, or if you have an inkling, if you have a family history.
Yeah. Take
and that comes to pass.
responsibility.
Exactly.
Yeah, take accountability.
That's the time.
Yeah, and that's the bottom line message that we're trying to send here. And we still have a couple of questions from cancer patients who know exactly about this journey that we are speaking of, and we're going to get into that in about 10 minutes' time. But right now, let's find out what's happening on the roads while we still have Justine on the line, courtesy of Andy James. So here are some questions from people currently going through this journey, living with cancer. Take a listen, okay, and respond immediately after.
After my diagnosis, everything feels just very overwhelming. So, what support should I be looking for that doctors don't mention?
You heard that?
I did, and I just want to thank that caller because it's very courageous for him to have phoned in and left a message. Taken that step in asking for help as well is just so important. Taking that first step and not trying to struggle alone. So a cancer diagnosis can feel overwhelming, and it's normal to feel anxious. Perhaps I could just use 3 points in terms of how he can seek support and some form of comfort. So the most important step, I think, is to stay in touch with your doctor and your healthcare team. They can guide you through treatment. And if necessary, ask your doctor about a palliative or supportive consult. Now, palliative does have a bit of a bad rap in that it's got negative connotations, but when we refer to palliative, we actually refer to supportive, more emotional support, and there are palliative doctors who are trained in assisting patients to understand their diagnosis and to seek the right type of support no matter where they are in their cancer journey. So I think that's important. Also know you're not alone. So there are organizations like Cancer, which stands for the Cancer Association of South Africa, and they offer counseling support groups and a toll-free helpline. And then lean on family and friends and take care of yourself, because it's so important to remember that it's about self-care and compassion for yourself. And that support does not necessarily mean counseling per se, but just having somebody to assist you with day-to-day tasks, or just having somebody who can sit and listen to you is sometimes all you need, just to take the edge off your anxiety and fear.
Wow, that's powerful. Thank you for responding to that question. Now we're going to take another question from someone who is also just fighting cancer in their lives at the moment.
Cancer treatment may be over, but the fear isn't. How can I, as a patient, navigate life after cancer without feeling like I'm facing it alone?
Thank you. Again, I just want to say to that person, thank you so much for phoning in, because she's probably raising a question that so many others have on their minds but don't have the courage to call and ask. And when someone's dealing with fear after a cancer diagnosis, even if treatment is finished, there's always a lingering fear. In for whatever reason, that perhaps that cancer may reemerge, or it might just be trauma after the treatment of cancer and what your body's been through on every level, emotional, psychological, and physical. And I think, again, I'll just mention 3 points so as not to overwhelm those who are listening. But 3 goals would be to acknowledge and normalize the fear, because fear is a natural response. So it doesn't mean that we're weak if we hold fear and anxiety. So it's normal to feel scared. It's normal to feel anxious. It's okay to feel this way. So validating the emotion is a first step to coping. And then focus on what you can control. So cancer does bring many uncertainties. It might mean loss of a job for some, or financial uncertainty, or things that I've already mentioned in terms of the reemergence of the disease. Attend your appointments, follow medical advice, and understand your treatment options. And I would say definitely prioritize sleep, activity, nutrition. And then lastly, it's something I'm very passionate about is self-compassion. So acknowledge the small wins and always remember self-compassion. So celebrate each step that you take. Avoid self-blame for feeling the fear. Keep your appointments and try and maintain a healthy lifestyle after you've recovered from cancer, and where you can, even during treatment. And I think to inundate people with too much information. But those are the 3 most important things that I would want to mention.
Well, I mean, Justine, thank you so much for your time, for your expertise, also your bedside manner. When we're talking about something as sensitive and as affecting as cancer, this is exactly the right tone to receive this information
format,
in. Thank you. Please continue doing the good work. We appreciate you and all the work that you and your colleagues do. Have a beautiful 2026, and thank you for all of this today. We really, really, really appreciate it.
You're very welcome, both of you, and thank you so much for having me. I appreciate that.
It's only a pleasure. All right, there you go. Justine Lacy, who is a clinical executive at Profmed, joining us.
Drive Home with Stacey and Jay Spoo, East Coast Radio.